Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today I'm joined by Federica, Lanzo, and Nicole, Allan from Orion Health. G'day team, how are we going?
Good, thank you.
They're good, Pete. Thanks for having us.
It's great to be here in the studio, and this is definitely not the first time that we've tried to do that introduction. I'm confident that this conversation will be on point, and I'm looking forward to it. So I appreciate you both making the time. Firstly, those unfamiliar with who you are, it'd be great to get a bit of context from you. Nicole, did you want to start and introduce yourself, please?
Yeah, hi, I'm Nicole, and I work for Orion Health. I am the VP of Solutioning and Delivery. What that actually means is I help to implement our solutions for our customers across the globe. And that can range from anything. We do a range of software implementations from HIEs, shared care records, to digital front doors. But I have a much longer history than that. I'm quite old, so I've been around for a long time and implemented lots of different systems over the years. And for the last sort of 25 years, being involved in healthcare delivery projects. So yeah, quite a range of experience. So I feel like I've seen it all.
There we go. Looking forward to diving into some of that experience there. But Federica, what about you?
Hi, Pete. My name is Federica, and so accent give it away. I'm from Italy. I moved to New Zealand and started working for Orion Health more or less 12 years ago. And from the start, I've been working with interoperability, data standards, data repository, what we do in terms of business logic, what matters in terms of integrations. So now I'm the product director for interoperability, which suits me well. Really excited about what we can do to enable patients and clinicians with the large volume of data that we have, as long as it made meaningful.
Totally. Speaking of meaningful, if there's a term that we've used a lot in healthcare for a long time is interoperability, and those in the know kind of know what we mean. Maybe we don't. And it's obviously a term that is not synonymous to healthcare, but probably relevant for this discussion if we kind of frame it. Because I also feel like sometimes with some of these common topics, it's important for us to reflect for a moment on what it even is that we're doing and talking about. I'd love to hear from both of you on what does interoperability really mean in a clinical setting? Maybe we'll start with Nicole, but I'm sure you've both got perspectives on both.
So I mean, you can talk about interoperability in a clinical setting in two main aspects, I think. One is from the patient's perspective and the other is from the clinician's perspective. And there is a lot of overlap in certain areas, and then there's a few differences. But basically, for a patient, it means not having to repeat your story over and over again, right? That the clinician treating you can go to a single source and find out as much information about your clinical history as possible. Means for you as an individual, and I've got a fair bit of personal experience around this, it means that you can have fewer appointments and fewer tests, which leads to less anxiety. Hopefully it means that you'll get better, safer care from your clinician because they've got all the information there for you. And then I think it's about having more coordinated care, particularly for those with quite complex comorbidities who also might have some kind of involvement in social care and community care as well. It just means that you're getting that more joined up care. A lot of those things obviously apply to the clinician as well. But I think in addition to that, what it means for them is that there's more time saved, right? Because they're not having to phone up to find out information about the patient. They're not having to log into multiple systems sometimes to try and track information down. So again, that then leads into that more complete view of the patient, that better patient safety, and that more coordinated care. I mean, when I'm trying to describe, all the time my family asks me, what do you do, right? And it's really difficult to try and explain this to them. And I always use the analogy of the universal power adapter. Doesn't matter where you go, what language, or what kind of the metric is that's being used for your power. When you use the universal power adapter, it converts it all into electricity that allows you to use your thing. So if you think of all these different systems that are using different languages, have got different, information within them, maybe using different technologies, it's bringing it all together. The interoperability is bringing that all together in a seamless way for the clinician.
Mm. I want to dive into that in a second too about the why we spend so much time on it. But Federica, too, like often depends on the lens, because the starting, like the fact that Nicole started with the patient benefit on the interoperability side is, I think, wonderful. But there'll be many CIOs, CTOs, just generally hospitals too, that will just be like, well, there's no, I mean, it's logical, right? You want to make sure if you're not duplicating information, you've got secure data, like having it is good hygiene as well too, right?
Yeah. So really, if I then follow up on what Nicole said, and great the metaphor of the translator adapter, I look at it from a more technical perspective. So Nicole, you really focus well on the outcome, what it means in real terms for people. I look at it, I can add more flavor to what it means from a more technical perspective, what the definition is of interoperability. And basically, it means integration at scale. So the ability to collaborate, share data, exchange information in a repeatable way without going through proprietary mechanism. So something that you can do once and you can repeat it many, many times, knowing exactly what to expect from each system. And this is what speaks very well for the CIO and the CTOs, right? So knowing that once you have interoperable mechanism or systems, then it's something that can be reused over and over again, gaining in terms of standardization, expectations, money, and time of implementation. But if you look at it then even more from our perspective, what R&D at Orion Health look at interoperability as is really the ability to bridge that gap between what what the market expects you to do, and what the customer situation is. Nicole can speak a long time discussing how our expectations for different standards can be, and then what you find in reality is quite different. So the role of Orion Health and R&D and implementation is really being able to meet the customer where they are, meet this organization, the solution, find their maturity model, and adapt them so they can be interoperable. So really, we are kind of interoperability enablers, not just with us, not just with our products, but speaking then to the larger ecosystem.
And I think Fedi's right. I mean, I do always start with the patient, but you've got to sell this to your CIOs and your CEOs, right? And I think whether you're the CIO of a healthcare organization or even maybe a vendor, what you've got to remember about this is interoperability provides a faster way to integration and sharing that information. It enables you to sweat your assets as well. Like rather than going out and building a massive monolith from the beginning to try and be all things to everybody, actually with good interoperability, you can sweat your existing assets. And that's got to be good for everyone, right? Because you can also start to choose best of breed. You don't have to try to kludge in an all-encompassing system to do everything. You can start to pick off smaller bespoke niche systems and integrate those together to get that best of breed solution. And that's good for competition as well, right? Let's be honest.
That is a great point. Yeah, sorry if I can follow up on what Nicole, I don't want to steal your job, Pete. But
please.
Interoperability really is a new word. It puts everybody on the same page, and if you're great at something, that you can really achieve big things. It's a very collaborative, but at the same time competitive ecosystem and landscape where innovation can really thrive. So I pick at one of the most popular standards nowadays, which is FHIR. The ease of access for developers that use FHIR, that learn how to embrace this new standard, is great, because in their own let's say, in their own house without being part of a big corporate organization. They can decide to tackle a small business case that nobody else has thought of because they're too big. They don't have time to think about that. But they can build a great app based on a standard that everybody understands it can use, and maybe sell it for big money. It's that ease of access, the entry to the market or to the use case that is making interoperability so great and exciting. That's why there's such a great momentum around the FHIR standard, for example.
This makes a lot of sense to me. But if I was to go back to Nicole's analogy of the international powers app, let's
Universal
say,
Power app, yeah.
and to stick with that for a moment, if I was, as with my side hustle of building a new 3D printer that I wanted to sell, I'm researching 3D printers, by the way, but if I was to build a new 3D printer, I would need to make sure it's powered by electricity. So I'll just make sure I'm using the right power. I can't invent my own power source for the 3D printer. That sounds like a bit of an absurd thing to say. And a lot of the things that you're talking about, I think a lot of us in healthcare agree of like, yeah, we need the information to be seamlessly kind of going around. It's good for the patient, good for everyone. It's 2025 and we're still talking about it, and we're still not like, it's not a requirement that is just a given. Like if I was to build an electronic device, it needs to be powered by this and it needs to meet these certain standards. But if I'm building an EMR or any health system, why are we still talking about this in 2025, Nicole?
Well, I mean, data is complex for a start. That's the first thing. And it's also expensive to replace a lot of legacy systems, right? So that's a big challenge. I mean, particularly a lot of our customers, we deal a lot with shared care records. That actually, to be honest, they're hybrid HIEs and shared care records. I've never really understood sometimes when an organization takes a decision to go out and just procure a HIE, right? Like, why not sweat that asset and make it a shared care record as well? But one of the things around that is that we have to integrate with a lot of smaller systems, especially as we branch out into things like community and social care and mental health and ambulance providers, right? We're integrating from all of these sources. Prisons, there's not a lot of money there, right? So some of them are running on systems that have been in place for 20 years. And one of the great things about integration and FHIR is I do think it does give you an opportunity. It's much easier for someone to maybe do that mapping in. So I do think we'll see the momentum grow at a much faster pace over the next few years than we have previously, where we've had some of the legacy standards. I mean, again, as I said earlier, I'm quite old and been around for a long time. So 20 years ago, I was doing integrations with web services, right? But what was missing was we didn't have the adoption of a standard, an international standard, let alone local standards that everybody talked to, and it made it a lot easier, and now makes it a lot easier for us all to know how we're going to share that data. People have always also come to recognize that we have to be a bit more flexible around the models and stuff as well. So they're not as rigid as maybe some of the old HL7v2. If you, for those of you that know that standard, it's quite hard and quite rigid, and the road to adoption can be quite long and challenging. So I think FHIR has definitely helped with that. I mean, from a personal perspective and an Orion perspective, we take an approach of, and a lot of my colleagues, they laugh because I use this phrase all the time, which is don't let great get in the way of good. I think it's very easy to get caught up in the standards and think, right, well, it's got to be absolutely perfect. We don't. We will work with those smaller vendors, recognize that maybe they're not FHIR enabled yet, and we will help them on their way. We might act as the bridge between them. So I think you're finding a lot more integrators as well, as where I'm going there, that will help overcome some of those challenges with the smaller, more niche providers that maybe don't have the same kind of capacity to deliver to these standards.
Yeah, actually, to build on that, Federica, I think about we seem very driven as an industry to be like, let's move to FHIR, or the what we're trying to do is to become FHIR compliant. But I guess there's a lot of, like, once we do that, it's like, cool, we can tick a box and say that it's compliant by these particular standards. But like, how do we move from just trying to be FHIR compliant to doing something a bit more meaningful? And what would that more meaningful thing look like?
Yeah. So I like how FHIR and meaningful always seem to go hand in hand in sentences and conversation. So FHIR, at the end of the day, is just a mechanism to share resources. That's what we call different objects that we see in the clinical settings, in the clinical domains. And FHIR really describe what are the basic mechanism to make sure that two systems can understand similar things. FHIR had a great push a couple of years ago, maybe 2018, 2019, with the 21st Century Cures Act. So we're talking in the US, the ONC took FHIR as the means for interoperability and made it compulsory for all the health IT vendors to comply with it. So that's where the big tick comes from. And there was a big push from the States. And then all of the other regions, the different markets, started to see the value in that and the saving of monies. Because the big problem the States saw is that by not sharing data, by not exchanging information, the government, Medicaid, Medicare services need to put a lot of money into saving people. People sometimes did not want to go to ambulance, emergency department, hospital being seen just because it would be too expensive. And then as a result, for the government, for the organization, would be even more expensive to address that. So what is the meaning of FHIR is really this flow, allowing the flow of data from one place to all of the others that it needs to go. Is that technical approach corroborated by all the other authentication and authorization standards that are adjacent to really enable the data sharing. So putting down all those walled garden that some of the vendors have put in place for a long time and realizing that this has to stop. Otherwise, you're applying information blocking. So this was a really, really great step for the health IT industry, recognizing that some vendors do not play well by the rules, and who gets caught in between is the patient. So sorry if I've gone a long route to your point of why FHIR is meaningful, why it makes data even more meaningful. Because from an interoperability perspective, FHIR gives you that basic vanilla structure of the information that everybody can understand. But then within FHIR, there's even nomenclatures that are internationally recognized. So you can make sense of data that is coming from all over the world if you abide to the FHIR rules. Nomenclatures and value set to even understand workflows which rely on these specific value sets. So it's really enhance your data when you're able to map it to FHIR so that everybody else can consume it, other health professionals or your patient.
Yeah, I think in terms of your question as well around, why it's been so slow to adopt, I think God forbid that I mention AI, but I do definitely feel that it is an area. It's what AI should be about, right? It's getting rid of a lot of the drudgery, and let's be honest, it's a dry old topic, FHIR and mapping data and ontologies, and and I'm in the industry, right? So I am enthusiastic about it, but I can understand why people yawn at me when I'm talking about it, right? And it's time consuming. It's really time consuming, particularly with, as I mentioned before, some of the legacy systems. And that's where I think AI will really come into its own as well with data integration. I may be jumping ahead to a further question here, but I do feel that, there is a lot of use cases we could potentially start to look at AI for around helping expedite that mapping, doing that semantic, interoperability piece and stuff that sometimes requires manual intervention or someone to code hundreds of thousands of lines to do the work, right? So
yeah,
I think it is one of the use cases that it will make a big difference to expediting these things.
yeah. When you think about objectively, a lot of the interoperability discussion is about, as you say, codings, like humans spending a lot of time doing stuff that machines are probably very much better at us doing. There's got to be a role for that, which we'll dive into it in a little bit. But I'd love to actually learn about today, Nicole, because I think Federica gave some great context, and as did you, in terms of FHIR and how we got to where we are today. In the real world, you kind of touched on these examples in passing too earlier, but like, what does that look like? Stuff that Orion is doing for their healthcare system. Are there particular examples you can share with me?
Yeah, so we've got I think 13 customers in the United States where we've implemented HIE solutions. And as Fed said, there was a real push back in 2018, 19, 2020 around the 21st Century Cures Act and being able to share data. And originally, as we all said, it was kind of a tick the box exercise, but actually, particularly around COVID, where there was a real push to share information more, we saw a huge amount of momentum. And all of us that were kind of like rolling our eyes and going, oh God, we've got to do this piece of work, in 2019. My goodness, weren't we glad we'd done it when, and see, I didn't swear there, weren't we glad we did it when 2020 rolled around and we needed to be sharing some information around patients to deal with COVID and stuff. So really great examples, I think, there of where our HIE customers in the US are being able to share out their data very easily and very quickly with little blockers to adoption, to, as Betty pointed out, to allow even smaller vendors to build apps that they're then going on and on selling to patients and the likes.
So those are some good examples in the US, but Orion's fairly global.
We're very global. So in Canada, we're using, we show great use of our interoperability to implement our digital care record, or a digital care record, but also our digital front door to allow patients to have access to their information. But we're also integrating with a number of different vendors as part of that solution as well. And that's all done via our interoperability. And Fetty can maybe jump in with some of the FHIR work that's done there. In the UK, we've got around 16 shared care records across UK, England, Scotland, and Ireland. Better separate them out. I lived there for 25 years too, so I better be careful. And they're actually, the integration there across, and this is why I talk so passionately to smaller vendors and making sure that you can integrate with them, is because we do focus a lot on hospitals and GP practices, but actually I personally have seen the value of integration out to the likes of social care and community. I spoke last week at Digital Health Festival about my father-in-law, who he was elderly. He's got a number of comorbidities, couldn't really move very well, lots of different people involved in his care. And he was getting quite anxious about having to do the same blood tests over and over again, or they book an appointment for him at a hospital, which was the same time as a standing social care appointment that he had. And this was all adding to his anxiety. So the interoperability to bring all that data together, once they were able to see everything and coordinate and go, oh, look, I'm going to book that appointment there, but he's already got one there, I won't do that. Or, oh, actually, I was going to order this blood test, but I can see he had it last week, so I don't need to have another one. It started to calm him down as well. And it actually helped improve his care, which that's ultimately what we're supposed to be doing this for, right? Like, it is about the patient's care. In Australia, we have got, again, I'd say it's they're more hybrid combinations between EMRs and HIEs. One of the ones I like to talk about is Justice Health, and we have a similar implementation over in Scotland, actually, where we're integrating with prison data. And you can imagine, prisoners go in and out of different facilities. Their records, when they come out and back into the community, don't always come with them, or when they go into incarceration, nobody knows what's happened to them previously. So the integrations that we've been doing there allow us to, bring all of that information together in a safe and usable way for the clinicians. And I think it just makes such a massive difference. I mean, I've got a GP that I work with in Scotland on the integration we're doing with Scottish Prison Service. And he was just saying it's been a massive game changer for him. He was treating patients blind with no history before. So it's saving him having to try and get information out of people who aren't necessarily that communicative either about their past. So having that information at your fingertips just makes doing the job so much easier. And he feels like he can provide the best care he can to these people. So we have a similar implementation with Justice Health here in Australia. And we've also implemented our digital care record over in this region also. And that's really important when you consider the geography of Australia, right? So rural and so remote. But I think where we can also benefit from it in Australia is things like the emergency services. So we all know we're getting a lot of fires and a lot of flooding in this country.
Okay.
And even people like ambulance services being able to have access to a patient's information if they're out in the bush dealing with someone when there's been a fire, like that is a game changer for those guys. And then being able to feed that information back into a hospital that they're depositing a patient to, it just means that the clinicians can be ahead of things. And I'm going to stop there because I'm super passionate, if you can't tell, about this, and I could go on forever. But I've seen it firsthand and it works. It just does.
Yeah, no, that's often we stop thinking about just trying to connect. It's hard enough to connect hospitals and primary care, or goodness me, aged care like care facilities and hospitals. But then as you broaden out further to anywhere that people require assistance, to those great examples you provided too. Why can't we do something at that magnitude? Yeah.
And I talk about patient care, but the clinicians as well, and, the information, but also their safety. Like, we're doing some really amazing stuff where we're taking in information about, where there might be someone who has a history of being violent or has a gun license or had a gun license taken off them. And again, you can't share that information with everyone, and you've got to make sure that it is true, because you don't want to be sharing untrue information. But if you've got that, it just also helps those clinical providers feel like they're able to do their job in a safe and secure environment as well. So there's all of these kind of byproducts that come from good interoperability.
Yeah, that's a very good point, Nicole. It's something that gets usually left aside. Interoperability, we're all adopting the same standards and happy days. No, there's a lot of work that goes behind the scene, not just the mapping to the standards. So privacy concerns, consent concerns, enrichment, what terminologies are we using? Are we mapping to the right terms? Are we doing auditing? So the people that are seeing what they're seeing, as they actually supposed to see it. So there's a whole layer of aspects that really need to make sure that interoperability is done right. So it's not just about integration, is integrating at the point of care that is needed by the people that need to access that information, nobody else.
And if you're talking in layers, if I was to layer in that, that emerging technologies and artificial intelligence and being able to do even cooler things with a lot of data that we have, I'm going to imagine, Fedi, that having, we're not able to make use of, emerging technologies like artificial intelligence in some of these systems without the right poles and wires, I guess, to begin with, or is it something that, since we've been struggling with it for so long, or that there's potential for tools like large language models and AI to be able to assist with some of this?
AI should be able to help us, but as Nicole said, it's a complex domain. It's a very complex domain. And, I studied back in the days precision medicine, artificial intelligence at university. I'm a bioinformatician. And I look at it very carefully still in the health domain, because the data quality that we see is not great. And artificial intelligence cannot do much. Machine learning, decisional trees and whatever cannot do well unless the data is curated. So there's a lot of manual and tedious work that needs still to happen. And it's going to be very expensive to make sure the AI machine learning systems can actually get something good out of what we have. And there's a lot of, it's people work. It's people for people. And when you have people, a human in the mix, as always, interesting, right? So I'm a big fan of what we can do, but we need to be careful where we apply, where we adopt it.
Yeah, sure.
Because I think data needs to be curated, and you probably need people in the first instance to do the legwork.
Yeah, it doesn't stop people from or executives and leaders thinking about how they can be utilizing AI within their work setting. Nicole, I'd love to hear from you on the ground. Like, what are people asking for, expecting of in terms of artificial intelligence when it comes to the data interoperability side?
Yeah, I mean, from a clinician perspective, it really is about giving them tools that allow them to diminish some of the grunt work that they have to do on a day-to-day basis, right? So one of the big areas of focus for us at the moment is, well, two areas actually: semantic search. So using AI to allow them to search across the information they've got and have it pull that back. In that, and semantic summary, same kind of thing, but bringing back a summary of the information doesn't mean you don't have the rest of it, and you still have to have the clinicians making the decisions and deciding whether they need to dig deeper into the information, but at least presenting them with a first pass at the key pieces of information that will help them treat the patient in the best way, right? Also, some of the stuff around the clinical coding side of things, which is the administrative burden they have at the end of, a discharge, for instance. So having AI help them to pull out the information to feed in, maybe write the discharge letter for them up front, that they can then review and add to, and not having to dictate it and write it all from scratch themselves. So I think, AI Scribe, obviously, it was massive at DHF. I mean, it felt like every second vendor was AI Scribe. Say what you want about it. It has a place and we need to embrace it. And I can see the value of it. I have a son who is studying medicine, and he is all over all of this stuff. Anything that allows him to actually do the things he wants to do, which is speak to patients, treat patients, perform surgeries, but without having to do all of the paperwork. And he said having to look up, even things like lab results and tests, and having those be able to do the first level of interpretation. And we've all heard the stories about AI having a greater probability of picking up cancers or, in a scan than the human eye. So that is the kind of thing the clinicians are saying we definitely want to use it for that, as long as we're there as the convener to make sure that it is all accurate. It's if it started doing it and then sending off, results to a patient and sending them on to the next part of their treatment, they're not keen on that, and I get that. But if it serves them up the information and makes that easier for them, that's a game changer for them.
Yeah.
Another great use case that we see in the interoperability world with AI is research for chronic conditions and rare diseases, where across the globe, for example, you have a handful of patients that are affected by special conditions, and the country, the nation, the organization are not that great at dealing with that, or they don't have enough information. So creating this international repositories that are mapped using the same interoperable languages, maps, coding, then will enable even AI to apply some logic or derive some patterns from groups all around the world. that is something that even FHIR is looking at with CQL, I think, special implementation guides, and that is a great avenue, I think, a great application for AI as well.
Mm. When you mentioned then, looking at other parts of the world and the drawing influence, and that reminded me, pre-COVID, I'm sure there was a social media post that I made, which was perhaps, I thought at the time, based on the feedback, perhaps naive in my thinking. I'm like, well, as an international traveler, why isn't my information kind of globally interoperable? And there was a lot of we can't even do it in Australia, let alone other parts of the world. How do we align things like this?
Yeah,
I know there's a lot of interest in the International Patient Summary here in 2025, and there's a bit that Orion does in this space too, or is looking at it with interest. Fedi, tell me a little bit more about that.
Oh, great. Thanks for asking that question, because it's a topic that is really dear to me. My development team is working really hard to make sure that we have very short times an IPS available within our solution. So we started looking at it in 2018, 2019. I think the big announcement was made when the G7 announced their agreement to share information across the different countries for those people that are traveling or they're working overseas or in other places that's not where they live. And that is really to facilitate the life of people that live essentially in the most advanced economies. But then this idea got further, and it was actually then embraced when more natural disasters, wars, pandemics started to be more and more frequent. And so what the IPS is, it's a health document, like it is your discharge summary, your CCD, your clinical note. And the goal of it, though, is to ensure that it encapsulate the critical information that represent the patient. And those are fundamental when you find yourself in a situation of unplanned or emergency care. So really, really useful asset to bring with you as a patient. And it's based on the FHIR standard, which means is suited for web app and for your smartphone. So you can actually bring it with you. The idea is that the patient is mediating the access to their own information. So what best example of patient empowerment is the IPS, right? Really, I can decide who has access to my critical information at any point. There are different mechanisms. It's not as trivial to build the IPS per se and to share it. But at Orion Health, we make great strides in the IPS generation. What are the rules? What are the context in which an IPS is generated? Because as you pointed out, even in Australia, if you travel around, people might not have any detail about you, right? So it's really, even if IPS was originally designed with the idea of emergency care, unplanned care situation, in reality could be used as a vehicle to transfer information. We've seen, we are part of the Spark program in Australia, and we learned big time thanks to the expert that we have available to us and through the connectathons that we participate in. So it's been a really great playground for us to test out ideas and to have feedback from the tech expert. So one of the use cases for the IPS is even referral to practitioner, transfer from GP clinic to GP clinic, as well as transfer to aged care facilities. So we realized that from the origin of IPS, there's been a sort of evolution and map to many different contexts in different ways, which make the IPS quite flexible, as well as a bit undefined from time to time, makes it harder for our implementers and vendors, but still the value it's really fundamental. Yeah,
which is probably part of the reason it's taken, again, back to your original question, Pete, why haven't I had this? Like, how come in 2025 I can't go to France and, if I go to hospital, have my IPS? And I think it is some of those sort of interpretations of, it's a meds list, right? Sounds easy on its own, doesn't it? It's a list of meds for the patient. But actually, for some of the most complex patients, like we've got patients in one of the ICBs within the UK where when you have a look at them, they've got like 20,000 medications over their lifetime, right? You're not sending that in an IPS, are you? So, right. And some of the medications are probably lower level things that they take, but are recorded so that somebody knows, like, that it might be a contraindication with something else. Which of those medications are most relevant and should go across, right? So that's a big part of the challenge, in addition to the information governance, which Fedi's just always having fun with whenever you come to sharing data. Whose data is it? What are the privacy rules around it? We could debate this one forever. Yep. My personal opinion, I don't care who sees my data if they're treating me. It's all good, like I want the best care available, but I know and I understand why not everybody feels that way. And it's a real minefield, I think, Fed. And it's not the technology that's the challenge for you.
No,
it's all these bits around the edges.
Yeah. And so this speaks to something that I really embody or embrace. Is interoperability is not a technical challenge. I'm stealing this from Grant Grieve, but I like to repeat it many, many times over. It's a social exercise. It's about people coming together, agreeing to what matters, and moving on and really finding solutions to problem. Yeah. That's why FHIR is doing very well, because everybody has really lined up with this way of thinking. And even when you go to connectathons or events, you can see that vendors are displaying their best attitude, their best intentions in working together.
Yeah. Community
for the good of the people. So that's why probably there's even this trend why FHIR is so popular.
I love that. And as I start to wind out this conversation, and I guess taking that lens of community or ecosystem wide approach towards this ever relevant topic around interoperability, if we were to go to both of you on this one, if you were to sum up, say, what's one thing the industry should stop doing when it comes to interoperability and one thing we should start doing? Nicole?
You just want one of each from both of us? What have you not learned from this conversation so far? So I think I've kind of talked, said it before throughout this podcast, is, not letting great get in the way of good, right? So recognizing that actually there is value in biting off small chunks and delivering on that. We don't have to deliver every interoperability domain under FHIR, for instance, right, to be able to deliver great value. And that's one of the things I like about our team at Orion, is that it's evolving. It's evolved over time. So we started out with a small subset and we were able to share that, and we're growing that. So that's one of the things that I think, we really should be focusing on. I think I'm just going to reel off a few things here, actually. I think an approach to broader adoption, and recognizing that, the broader the adoption, the greater the impact. Again, I feel there is, having come back to Australia, I still hear a lot of focus on hospitals and GP data. And I would like to hear a little bit more about community and mental health and social care, and giving that full holistic view. Even, your allied healthcare professionals, your dentists, your optometrists, that broader view, and recognizing that you can have a really great impact on a patient's care, and that's got to be the focus, right? The patient's care. If you do that. So, and my final thing would be stakeholder engagement. Always, all the time, stakeholder engagement, get them involved. And that's actually one of the things I really, really loved about the Sparked community, is having been to a couple of events, there's people from all walks of life. It's not just a room full of technologists. They do have your GPs. There were social care people. I loved that there were allied healthcare professionals there who are always sort of bottom of the food chain when it comes to access to a patient's information and just talking about the impact it was having on them. So again, just continue the momentum around stakeholder engagement.
Yeah, love that. What about you, Fedi?
I think the industry and the vendors should stop protecting their data because it's not their data, it's the patient's data.
Mm-hmm.
So stop putting hurdles, proprietary APIs, making people pay to access their data. Wait, I'll give you a compact disk if you sign this form and then I'll give you your data. What? No, please, let's stop that. Absolutely. And let's start thinking, I'd say, more innovatively and think about what you're great at, what you're good at, where your skills are, what your segment is, and just go really for that. That would be my my stop doing that, please, industry.
Love it. No, look, there's two really great recommendations and sums up the conversation nicely. We could have this chat for a lot longer, I'm sure, Nicole and Federica, but we're going to have to leave it there. We'll put the details for Orion Health can be found in the show notes of this episode, and of course on our website as your THG Plus partners as well. So, Nicole, Federica, thank you so much for your time.
Thanks for having us, Pete.
Thank you for having us.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.